Good morning. I'm Joy Robbins. I'm the Global Chief Advertising Officer for the New York Times, and it is my honor to welcome you all to this morning's Air of Resilience, Championing Lung Health in a Changing Climate, this morning's breakfast conversation presented by AstraZeneca. It's a privilege to gather here with such a distinguished group of leaders from across business, policy, healthcare, and technology. Industry voices who recognize that our collective future depends on the actions we take today. We often talk about climate change in terms of temperature and weather, but the air we breathe is where climate crisis meets our everyday lives, our economy, and our health. This morning, we'll explore the urgent intersections of respiratory health, environmental policy, and social equity, and we'll hear from those who are working to build systems that prioritize early detection, prevention, and access for all. I also want to extend our gratitude to AstraZeneca for sponsoring our full-day Climate Forward event for the second year in a row. On behalf of the New York Times, thank you for being here this morning. We're thrilled to begin the day together. And now to introduce Dan Wygal, Vice President of U.S. Corporate Affairs at AstraZeneca.
Thank you so much. Appreciate it. Well, good morning. And I'd say good morning and thank you for being here so early. Your presence is a testament to your commitment, especially at the early hour. It's always a bit anxiety-ridden when you set a breakfast table. Will people show up? And you have. So thank you so much for the engagement. And it's a pleasure to see you. I'm truly delighted that we have the opportunity to sponsor today's session. And I think the conversation, of course, will be engaging. An area of resilience, championing lung health and the changing climate, is really what we are all curious and here to talk about. As said, I'm Dan Wygal. I'm Vice President of Corporate Affairs at AstraZeneca, and I have the privilege to lead a team that focuses on communications, policy, patient advocacy, and patience, really. And in the purview of everything we do, we take that ethos of doing it for the patients, and I know that's what drives and motivates all of us. So, as stated, this is quite a diverse room and quite a diverse panel that we'll have an opportunity to hear from today. And your commitment and the opportunity is a shared sense of responsibility about making progress for patients. So let me set the stage here by sharing a jarring statistic from the American Lung Association's upcoming State of the Air report. This year, 156 million Americans live in areas affected by dangerous levels of air pollution. This is nearly half of our population. The number is deeply troubling, as it also represents a 25 million increase from just the year prior, and the highest levels in the past decade. The factors at play include a more frequent and severe wildfires, underscoring what we already knew, and that is how the environment is directly linked to public health crisis and challenges. The resulting rise in respiratory illness, such as COPD, asthma, and lung cancer, is a burden for patients and, of course, their families. But it is equally a burden for our healthcare system and our economies. For all of these reasons, we must take action. With all of that said, I remain, and I hope you do too, optimistic. With the expertise in this room, there is an extraordinary potential to illuminate the gaps in care, but also to consider and understand how the environment and socioeconomic factors shape outcomes. With that knowledge, I know we can help more people live healthier lives. Our aim today is not only to raise awareness, but to foster collaboration. I've already seen an incredible amount of networking this morning. Please continue that. I hope our discussion will spark tangible opportunities to improve care and advance health equity, and that we'll learn more about policy solutions that can help us reach our goals. That together we can improve lung health across America. Before I hand the program over to Joel Makower and our impressive lineup of speakers, I'd like to share a short video that demonstrates AstraZeneca's recent partnership with industry and community organizers to support those devastated by California's wildfires. whether it's delivering free lung screenings in our air mobile unit or empowering first responders and local residents with vital educational resources, which is key. Our goal remains clear: to help more people breathe easier, have healthier lungs, and live happier, healthier lives. Thank you again for your dedication and being here. Let's cue the video.
In the wake of the Eaton fire, Health, Hope, and Healing took center stage yesterday for the Pasadena and Altadena communities, as Health Equity Leadership Summit sponsors teamed up with local partners to address the fire's urgent and long-term health impacts.
The Eaton fire was one of the most devastating wildfires we have faced. As wildfires become more intense and more frequent, their health impacts are lasting, not only affecting firefighters, but every member in our community.
Wildfires don't discriminate, but the health effects are felt by the most vulnerable communities. Today, we're connecting residents to screenings and resources to address the needs of long-term lung health effects.
Smoke exposure can worsen existing lung conditions and increase cancer risk. That's why regular lung health screenings and making them accessible to everyone is so critical for early detection and improving outcomes.
Our priority is always our first responders and our community members. That's why we're here in Pasadena and Altadena. We're bringing vital resources and education to those who are most affected by the Palisades and Eaton fires.
The Eaton fire is a powerful reminder that healthcare is not just about medicine. It's about being present in the community, showing up and working with each other, and making sure underserved areas and underrepresented populations and communities have real access and real support, so no one faces these challenges alone.
In our general collaboration, we're now able to bring patients in the community information on lung health, free screenings for them within their community to increase their access to care, and also all of the opportunity to connect with the care providers in their community and all the local resources that are available to them that they may not have known were available.
California physicians are driven by one belief: every Californian deserves high-quality health care, regardless of who they are or where they live. This community event and our Health Equity Leadership Summit demonstrates our collective commitment to equitable care for all.
So Gene, I think you're well known as the former head of the Environmental Protection Agency under President Obama and the first ever climate advisor, White House climate advisor under President Biden. I don't know if people know you necessarily in the public health realm, but you've come from that and are back in that as well. Give us a little just background on that.
Well, they should know that. I think my face sort of acknowledges that I've been around for a while. Not just President Obama and Biden. I started out my career, let's see, I really don't want to admit it, 40 some odd years.
I'm right there with you.
And I was always fascinated by environmental issues, and climate became one of obviously my necessary focuses of attention. But, I started out, I think my job was called a health agent. You remember the health agents from a long time ago? They're probably still around for as much as I know. Basically, I worked in a small town in Canton where my family grew up. And I decided, I went to school. I was really fascinated by the challenges that I was seeing. And as a health agent, you run around just trying to figure out what's going on. What are the challenges that we're facing? And honestly, my enchantment with this work really became something that happened when I was a little kid. And you couldn't ignore the air quality challenges.
This is in Western Pennsylvania? Or Western Massachusetts, I'm sorry.
It was Eastern Massachusetts, but you were very close.
I was close. Eastern United States, so I was in ballpark.
I grew up at a time when the air quality was horrendous, and I know you're all shaking your head, but most of you have never seen anything like this, thank God.
except if you travel a bit. And it just stuck with me. I can remember I was in St. John's Parochial School in Canton, and the Plymouth Rubber Company lived across the street from the school. And so every day when they were doing batch processing of the materials at Plymouth Rubber Company, the nun would stand up and go, "Quick, shut the windows, shut the windows." And we had to shut the windows, but the stench was horrendous. And that has made more of an impression on me. I was probably 6 years old, but all I can remember is running as fast as I could to shut those windows, which made absolutely no difference whatsoever. But it became, for me, just a rallying cry for what I would do with my life.
Yeah.
And I just don't know. I think when you're 71 years old, you can remember so many of the challenges that we were facing that no longer seem quite as relevant, except in other communities that are challenged by income levels or housing constraints. That's when you begin to get that sense. So we've made a tremendous progress in some of that, but we have so much further to go. Well, and now with obviously the challenge of climate change, it just wipes out sort of a lot of the progress we've made and adds a new confounding factor to how we keep ourselves and our kids healthy.
Yeah, well, let's talk about that, because you traverse the policy, education, and philanthropy, and I think the private sector as well. So you've got a pretty broad view. I heard you say the other day that from the perspective of clean air and environment and climate we're in, I want to get this right, a pickle. And I think the pickle probably has something to do with the fact of potentially rolling back the endangerment finding, eliminating the need for companies to report on emissions. Yeah. So how do you view this moment through the lens of clean air and climate?
Well, I think in some ways we're very lucky to be living where we are. I think the thing that I always keep in mind is things were bad, things are better. Then things are worse and things get better. And so to me, I think we do have to realize that the job we're always doing when it has to do with environment or health is like a constant battle to actually continue to move forward and never to slip back. And I think the challenge of climate change, which I came to over the years as being, one of the fundamental things I work on all the time, is that it's a confounding factor that we cannot control unless we do that nationally and internationally. And so I'm here a lot to me have those conversations about what we do and when. But Joel, it's just really important to remember that when you fight against something like something for clean air, or when you try to address the challenges as complex as climate, you have to keep fighting all the time. You have to keep pushing forward. And Joel, I know you know about climate as well as I do, and it's just such an exacerbating factor. But we've been, there's a lot of bright spots. I don't want to talk like we can't fix this stuff or we can't make progress. But the progress we made when I was a kid was enormously hard fought. I mean, it was unbelievable how different the world is today.
Well, one of the big differences is that back then, clean air was not controversial.
No.
And now it is.
Yeah.
So how do we think about it differently in terms of how we affect the kinds of change that we need to be having right now in a time when something so basic as clean air, clean water for that matter, is not seen as a universal right?
It has to be a universal right. I think we all know that. I mean, the folks sitting here, including myself, are very privileged to not have to worry as much as many other folks in many other parts of the United States, never mind the rest of the world. And so it has to be a human right, just the same as access to clean air, clean water and food. Those are all the things that we absolutely, by necessity, have to have. And to even suggest that none of those things or any one of them is not a right instead of a privilege is kind of an amazing.
It is,
it's a deflection for people who actually would prefer that most people not reach their stature in life because it's a control issue. And so we have to fight that.
Control issue, explain that.
Because I think that, we see this internationally, and we see this in the United States. We see it with our own president. They can deny what's right in front of their face, and in order to make sure that they can control the situation and the narrative.
So clean air is a control issue?
Oh, yeah, very much so.
How?
Yeah, very well. It goes hand in hand with poverty.
Right.
It goes hand in hand with governments that want to control folks that live in poverty, and not to the extent that they're hoping to make everybody poor, but they're hanging on to their own richness.
Yeah. So we have in this room an audience of healthcare professionals, private sector, corporate executives, educators, advocates from across the nonprofit sector. Where do you see as the institutional acupuncture that we can insert and have an impact that where we feel that we're actually having sort of punching up in a way? Where is the biggest impact point that we can be looking at right now? Is it policy? Is it on the corporate side? Is it at the community level? Is it at the national level? What do you want to see happen?
It's all those levels, Joe. Because as long as I've lived, I've never seen anything good start at a high level. Everything good starts from the ground up.
Yeah.
And it does. If you can find an example where that's not true, I'll give in, but I've never seen one.
Yeah.
It's all about getting communities organized. It's all about building strength for them and with them. And I know that we've talked a lot about the challenges, but, I'm spending a lot of my time just remembering every morning I get up that we have hope, that we have an opportunity in building that sense, because that's what people thrive on. I talked about the nuns. Man, all they did was ever punish me. That's it. What'd you do that for? Where's your homework? Blah, 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 blah. But, after a while, it's like, I'm going to let go of that stuff and I'm going to have some fun, which is why I got really punished. But the issue is, the thing that I try to do now is I recognize the challenges, but I try to remind people that we have opportunities today that we have never had before. So I am absolutely filled with a sense of hope and opportunity, and I won't let it go, because I have never seen anybody who actually led a movement and made change in the world that sat around with a puss face saying how awful the world is. I saw that at the UN yesterday. Leave it there.
Yeah.
Right? Because we have stuff to do. We have work to do. We have opportunities. And we have a mass of human beings that have no access to that opportunity. And that's really what we have to focus on. Because all of these things are intertwined. Climate exacerbates the challenges that we have. But fundamentally, you have people that do not have healthy housing. We have people that cannot access clean food, that have literally no access to clean air. And we're sitting around here talking about what we should do. Well, it's obvious what we should do. Work really hard at fixing problems because we have too many to sit on the sidelines.
I always love it when you get wound up.
Sorry, I wasn't one. You ain't seen nothing yet.
Well, we don't have a lot of time, so we gotta work quickly here. But
Okay.
When we meet again at New York Climate Week 2027,
Yep.
2 years, what do you hope it will have happened?
Thanks for reminding me it was 2 years because I might have forgotten. No.
How do you want the conversation? What do you want the conversation to be about then? And where should we be?
I think it has to be about solutions, right?
Yeah.
I mean, we all know the problems we're facing, and honestly, if it's not more about building resilience and safe places in communities that are most challenged, then I'd be enormously disappointed, because I feel like I'm a very privileged person, and I think my family is privileged as well. But I'll tell you, I have a 5-year-old granddaughter who has terrible asthma problems, and I know that she's living in a house that we're trying to help with and make it healthier for her. But when you watch that signal on people's faces, especially little kids, when they have that fear of whether they can breathe, whether the air is going to be able to get in their lungs, you can't run away from that.
Yeah.
And so I think my hope is that in 2 years, we'll have seen a shift to a recognition that climate and health and the environment and the challenges that we're seeing with heat, and it is finally going to be given the clear direction that it needs.
Yes.
Because we can't do everything at once. But if it is not about building constituencies in low-income areas and supporting those constituencies and moving forward, then I'd be enormously disappointed,
Yeah.
Joel.
Well, on behalf of your granddaughter, let's all do this, and we're going to talk a little bit more about on the front lines in just a second with a great panel. So, but for now, please join me in thanking Gina McCarthy. Thanks, everybody. Let's continue the conversation. I have a terrific panel here. I'll just go down the line. To my left is Matt Rahn, the Executive Director of the Wildfire Conservancy. Next to Matt is Heather McTeer Toney, who's the Executive Director of the Beyond Petrochemicals campaign. And at the end is Alison Lee, Dr. Alison Lee, pulmonologist physician at Mount Sinai, Associate Professor at Mount Icahn School at Mount Sinai. I think I got that more or less right. So I'm going to, Heather, start with you. We heard Administrator McCarthy talk about, being on the front lines, being in the communities. First of all, just give us a little bit sense of Beyond Petrochemicals and the work that you do down Cancer Alley.
Yeah, well, thanks so much for having me here, and good morning to everyone. I echo those sentiments. We've got to have the most committed people here early in the morning, so thank you for being here. I run the Beyond Petrochemical campaign. We have one sole mission, which is to stop the expansion of petrochemical facilities in the U.S., particularly in communities that are overburdened with pollution. So if you think about throwing chalk at a ghost, that's what we do. We throw the chalk so that you can see where these facilities are proposed to land, and then work with communities as they're already actively working to stop these facilities. I am thrilled to say and share that since 2022, we have stopped 31 facilities from locating in the United States in some of the most overburdened and overpolluted communities. Now, I got to say that this passion is not just because it's so bright and early in the morning, but I've been doing this for a while. I'm a recovering politician. I started my career as a mayor in Greenville, Mississippi. I'm from the South. And then I had the pleasure of serving as a regional administrator for EPA in the Southeast region under Gina McCarthy. So when she says that she's just now, this is not wound up, trust me, she's absolutely right. If there's anyone who's passionate about communities and ensuring that we understand that the mission is to protect human health and that human health comes first. It was working in your amazing leadership, Gina. So thank you so much for that. The communities, I think, are on the front lines of this. They also know what they're doing.
Yeah,
they know exactly what they're doing.
So I think it's pretty clear what the connection between petrochemical facilities and air pollution. But how does climate exacerbate that? What's the connection?
You know, there's a cumulative impact here. And it's so important, especially when we are looking in places like what's known as Cancer Alley. If you're not familiar with that area, it's an 85-mile stretch along the Mississippi River, Louisiana area that is full of petrochemical facilities. So when you think of the spaces where all of these facilities sit, naturally those are places where you have high rates of asthma, cancer, lung disease. It's also where hurricanes come. If you look at the track of hurricanes over the length of time that NOAA has been tracking them, we did this exercise just to see where the hurricanes consistently go. They go over the same places where you have these facilities. Oh, it's also the places where you have high rates of poverty and educational disparity and food deserts. And so in these locations, there's a cumulative impact of things that not only exacerbate public health problems, but also that exacerbate climate problems. So we have to look at these things together. Otherwise, we miss where we could see some possible really strong solutions.
Yeah. So Matt, Wildfire. First of all, I was not familiar with the Wildfire Conservancy. Talk a little bit just to give the elevator pitch on that.
Sure. The Wildfire Conservancy was started brilliantly at the beginning of COVID. So perfect time to start a nonprofit research foundation. But it was actually built on about 15 years of prior research, education and training on wildland fire issues and specifically wildland-urban interface as well. And so our mission are threefold. One is to improve attack effectiveness. So we work with firefighters and agencies, do the research to understand how to fight fire better. We also work on a lot of issues related to community resilience, how we design and protect our communities. But our biggest area of focus today is on firefighter health and safety and protecting those that protect our communities.
And so talk a little bit more about that, the firefighters, how you're helping them, and it's their own health and safety, or also the work that they do with the communities.
Well, I think it's twofold. So, the firefighters are now an unfortunate canary in the coal mine when it comes to a lot of what we're talking about here today with air quality and health impacts. They receive the highest levels of exposures from all of those materials that burn. We had this myth and misconception that vegetation smoke wasn't bad. It's extraordinarily bad, and there are tons of cancer-causing substances emitted during combustion. But now you place those fires in the urban interface where you have vehicles and infrastructure and houses all burning at the same time. It is a remarkable cocktail of just hazardous, toxic, and carcinogenic chemicals. And so they receive these exposures, and they are exposed, dying, and recovering, fortunately, from cancer at rates far higher than anybody in the average population. And so anything we learn about those firefighters really is something that we can help answer questions in the general community, because as you saw in Los Angeles earlier this year, that inversion, that smoke that sits over our community for weeks at a time now causes massive amounts of health problems. Cedars-Sinai did a whole study on just their own admissions for cardiac and pulmonary issues. And we're talking about, thousands of cases and millions of dollars spent just for folks who aren't actually working on the fires.
Yeah. Well, Alison, I know this is an area that you spend a lot of time in. One of the areas that you've looked at is the Lahaina fires in Hawaii a couple of years ago. And let's talk about the research that you did there.
Yeah. So by way of background, I'm a pulmonologist, but I'm also a clinician scientist. And so I study air pollution and climate and how it impacts health. And we all know that dirty air is not healthy air. And science tells us how this works. And science also tells us that children in particular, whose lungs and brains and hearts are still developing, are particularly sensitive to air pollution and climate impacts. But I think importantly, science also shows us how community-led solutions and community partnerships can clean up the air and improve health. And health is a really critical concept because anyone who has had disease understands that it is invaluable. Health is priceless. And we need to understand that health is eroded over our entire life course, beginning in early childhood by air pollution exposures. And so, as you mentioned, I've been fortunate to work for the past few years with a group at the University of Hawaii on a study led by Drs. Alika Maunakea and Ruben Flores, the Maui Wildfire Exposure Study. And there, this is a longitudinal cohort. So we're trying to understand the long-term health impacts from the deadly and devastating Maui wildfires. And what we see is not only the immediate impacts that you would expect, the impacts on lung health and mental health, but also the long-term, now over 2 years later, the long-term and really lasting impacts that extend beyond health. You know, as Gina was talking about earlier, we see continued housing instability. We see food insecurity. We see economic instability. And these factors influence health. And it's not just the health of the adults. It's really intergenerational effects. So also the health of the young children. And so I think it's just critically important that we think about this from a health perspective and how do we preserve health.
It's struck me for a long time that physicians, medical profession, could and arguably should be at the front front line here in terms of, because they're interacting with people with real health problems, and making that connection to not just air pollution but to climate. And I'd love to hear how in each of your connections and work with the medical community, is that possible, or doctors just want to stay away from the big issues? Because that is, I mean, we're all canaries in that coal mine if we're breathing that air, and yet we don't necessarily understand those connections.
Right.
What should we? I see happen here.
I mean, I think this is a really critical point. And how many people in the room have heard of Ella Kesey Deborah? So Ella was a young girl who lived in London, and she lived near a major roadway. And at the age of 7, Ella was diagnosed with asthma. And she then had dozens of asthma exacerbations, severe asthma exacerbations. And at the age of 9, Ella passed away from a severe asthma exacerbation. The coroner in Ella's case made the determination that air pollution led not only to the development of her asthma, but also her severe asthma exacerbations. And in fact, Ella is the first person in the world to have air pollution listed as a cause of death on her death certificate. And I had really the honor of listening to Ella's mother, Rosamund, speak earlier this year at the WHO Air Pollution Conference. And there she said that no one told her that the trucks and the cars that were passing by their apartment were producing that air pollution that was harming her daughter's health. And she said, if I had only known, then maybe there was something that I could have done.
Yeah.
And there are things that we can do. And I think physicians being educated, all healthcare providers being educated and be able to counsel our patients on the importance of air pollution and how do we incorporate air pollution into our prevention and treatment plans is critical.
Heather, where does the healthcare community fit into the work at Beyond Petrochemicals?
I think they're such a critical part. You know, it is, it's unfortunate that story we hear repeatedly over and over and over again. I was in St. James Parish a few weeks ago with Sharon Levine and former Vice President Al Gore, and we were at a community meeting where a woman stood up and shared how she had lost her 9-year-old son to an asthma attack. So these issues we hear over and over and over again. I think that there are, to your point, a few things that we've learned from frontline communities. One is that they know that there's a problem. They know there's a problem. They can feel it. They can feel the stuff in the air. Their children are sick. They're missing days from work. They know there's a problem, but they need the policy and the research to help show that the problem exists. And we believe that if you can't measure it, if you don't measure it, then you can't manage it. And we're in the work of working with communities and physicians to ensure that we're monitoring, we're supporting communities that want the monitoring to know what's going on so that they can say it. I think the second thing is that there is an extreme amount of disinformation. People in community are overwhelmed with being told, oh, it's not the plant, it's the fact that you're poor. Or no, it's not the stuff coming out of that building over there. It's the fact that you're overweight. That's why you have asthma. It is the so many different issues that are thrown back to the individual versus dealing with the actual issue of the air pollution as a main factor of why they have chronic disease. So cutting through the noise is part of the issue here, and ensuring that we have allies and partners that are supporting community with the data and information to just cut through the noise. And I think the third thing is just sharing it, making sure that we're not talking about this in a silo, that we're not just individualizing it, but we're actually talking and sharing with policy makers, with friends, with neighbors. We're not keeping it to ourselves, and that education is being passed on.
Yeah. Matt, I imagine there's a lot of education between the health agencies and hospitals in terms of working with emergency response community. But is it a preventative way, or is it simply taking care of the problems once they arise?
Yeah, unfortunately, I think it's all reactionary, right? Let me make throw out a quick statistic here. 88% of all firefighters nationally are now dealing with wildfires. This is no longer a California issue.
88%.
Yeah. Even more frightening is that only 20% of them actually have the training on how to deal with wildfires. So as this has been evolving, and you've seen it just recently, North Carolina, you see it in Connecticut, Tennessee, this is now a national issue. The idea that we have a fire season is it's an antiquated term. It's a fire year. Our largest fires in the nation are now happening in the winter time. And it's no longer a wildfire, it's an urban interface fire. So why is all of that important? Because this all directly impacts our communities and our health in those communities. And then, bringing it back to the idea of climate change, just a handful of these largest fires that California has experienced in recent years has wiped out all of the gains that the state has made in its climate initiatives. It's absolutely devastating. And then to speak back to Lahaina, these incidents, you have to imagine, and I think it's very appropriate we're here in New York talking about this, because whether it's Lahaina fires, whether it's what happened in the Palisades and Eaton fires this last year, Camp Fire in Northern California several years ago, these are 9/11 scale exposure incidents for those communities. But we are not talking about them as though they are, and we're not treating them as though they are.
Yeah.
Can I add one thing to that? Because I think it's so important what was just identified about the percentage of our firefighters that know what they're dealing with in terms of wildfire and the air pollution. Because as the wildfires were happening in California, little was it known that there were fires happening in Louisiana while flooding was happening. And so the mind cannot conceive of how climate change has so impacted us that you can have water and fire in the same place at the same time, and we're just trying to figure out how to breathe and don't know how to do it. So I just think that's such an important point for people to really grasp the gravity of what we're dealing with in this moment.
Talking about flooding the zone, literally. So we were tragically short on time here, and I want to get to see if there's some questions out there and bring Gina back up to answer them. But we're on a bit of a race against the clock here. So what's the one thing that each of you wants to leave this audience with? What's the one thing you really want them to know and do? Alison, I'll start with you.
Yeah. I mean, from my perspective, I think science. We need more science. Science has led to just incredible advances in human health, but we need continued investment.
In what?
I think understanding, how air pollution erodes health. The science that tells us that air pollution is harmful to health is clear, it's consistent, it's strong. I don't think that's in question. But we need to better understand the mechanisms so that we can start to develop
novel prevention and treatment methodologies. So I think that is critical. We need to invest in science.
Right. Heather?
Definitely looking at what is and how do we stop petrochemical expansion and build out. It's plastics. And we really need to take a look at what the plastics issue is with respect to our bodies, human health, and people. And recognize that this is not a singular issue. It's not just something that impacts poor or rural communities. It is not a one-sided issue. It's not a political issue. There are conservative communities that are dealing with this. There are evangelical communities that are dealing with this. So we've got to take all of the siloing off and be ready to address this as a human issue.
Matt?
There was a time when our rivers were catching on fire. The symbol of our nation, the bald eagle, is going extinct, and you couldn't even see across the street in downtown Los Angeles. It didn't matter if you were a Democrat. It didn't matter if you were a Republican. Everybody could stand by the shore of that river and say, this is bad. Let's do something about it. And so we went through an era where we developed policies that were responsive to this, but knew that we weren't going to get it right? It had the flexibility, it had the ability to meet the need, but know that we still have a lot of science to do. We have a lot of research behind all of this to get this right. And today you can see those just massive gains, especially in air quality across the country. Today we're in a bit of a decision paralysis when it comes to policy and legislation. We hold back on creating things because these concepts of climate change or wildfire risk are so overwhelmingly complex and massive that our decision makers do not pass the kinds of legislation, policy, or regulations that are necessary to make adequate change. And a lot of times they turn to the science and say, well, we just don't understand smoke well enough. And I recently said, smoke is bad. What more do we need to know about it? I mean, there's hundreds and hundreds of studies that document this.
Yeah.
So if we could get past that hurdle and remember those days where we built in that flexibility and understanding, saying we're not going to get it right today, and it's not going to be perfect, but don't let perfection be the cause of inaction.
Yeah, great. Well, I want to see if we can get a few questions. And Gina, I'm going to move over here and take the chair. I want to see if we get 2, 3 all at once, and then pose it to the panel. Is there a mic somewhere, or is a mic here? Who wants to answer all of your questions? No? Oh, okay, great. There's 2 questions right here. Let's hear them both from over here and over here. Go ahead.
First, good morning. I'm Ruth Ann Thornton. I'm with the Green and Healthy Homes Initiative. We're headquartered in Baltimore and work across the country. And Heather, or Mayor, or
Heather is fine.
We have an office in Jackson, so I'm glad to hear that you're from Greenville. But we work in the housing space for similar issues, right? And in the work we do in California, the impact of indoor air quality, the wildfires. But in Western Maryland, where FEMA just denied help to an area that had been flooded out, a 16-year-old died of asthma from mold-induced.
We need to get to the question quickly.
Yeah. So, but my question here is, I haven't heard the issue of housing. I'm hearing a lot about outdoor air, but indoor air quality from poor housing condition and what's getting trapped inside. Sort of, what are you seeing on that front that is critically important?
Okay, and then we got a question right here, and let's address them. See if we can tie them up in a nice bow and address them together.
I thought.
You're on. Go ahead.
Hi, I'm Linda Brown. I'm with SCS Global Services and our Global Heat Reduction Initiative. And I thought I would ask more, but I'm just going to focus on where do you see the private sector supporting all of your concerns and hopes for direction?
Okay. So we have housing, and we have the needs of the private sector. It's as we say in basketball, a jump ball here. So who wants to take on any or all of those?
I could try to do them a little bit together because the housing industry is one of the industries that has the biggest opportunity to reduce plastics and to reduce petrochemical in their building materials. And that's certainly in the private sector and private industry. There's a partnership and a research that we did with an organization called Habitable, where we actually looked at that And one of the things that we found is not just in the United States, but there's interest globally in understanding that if you reduce the chemicals, toxic chemicals within building materials, not only are we improving the health of people who live there, but we're also reducing this emergency response that we see with fires. Because as we know, in the fires that happened in California, plastics were burning inside the house itself, along with all the toxic chemicals that were inside of the homes, which made it just a toxic soup mess. And I think one of the challenges that we find in more impoverished communities is then the desire to go back and build is they're asked to build back to what they had. And that does not solve any problems whatsoever. In fact, it makes the situation worse because what we have now obviously is not sustainable in the climate environment that we're in. So I think there's a lot of work that is combined with both community engagement of saying what people want and need, policy leaders listening and making changes, realizing that there's economic benefit in that, and then finally private industry being willing to put back into communities the things that would actually stick and stay. That's not plastic and toxic.
Gina, I'm going to give you the private sector question, and unless you wanted to quickly add, we've just got a minute. Okay, we only got a minute or two, so go for it.
Look, that one of the hopeful things is that, what we know is that fossil fuels are at the bottom of much of what we're talking here, right? So what about clean energy? It's cheap. And by the way, it's cleaner, since I can reemphasize that. And so I think it's enormously important. And I think you're seeing this, although under the radar screen, there's a tremendous amount of public investment going into clean energy, and for very good reason. And that's not, just here. It's all across in the EU and everywhere. People are beginning to realize this. That would provide enormous benefits for clean air. Enormous. The same thing with clean cars. If we can't figure out that basically an electric car is a better car, then go drive one. You're missing the whole point. We are not talking sacrifice here, folks. We don't have to do that. We're just talking about the opportunities of today and capturing them as best we can. And a lot of those are really tackling some of the fundamental problems that we have seen, like our continued addiction to fossil fuel.
Yeah, I think that's a great punctuation point on this, the better homes, better communities, and obviously better air. So much we could
love heat pumps, by the way.
Heat pumps. All right, there you go. We are at time here. I don't want to let this great audience go on with their day. Thank you so much for being here. Thank you to AstraZeneca and the New York Times. And please join me in thanking Alison, Heather, Matt, and Gina.